Hello, my name is Angie. I'm a nursing student from University Kebangsaan Malaysia. This video is my academic assignment for module Gerontology, and I'm going to show you this mind map. The topic is about mental health disorder. I'm going to focus in 4 parts. The first one, relationship with aging. Second, health promotion, nursing consideration. And the last one is a selected topic by my lecturer, which is depression. Let's start from here. Unfortunately, in our society, there are a lot of myths which are wrong. For example, loss of mental functioning is a natural part of old age. Second, stereotype descriptions. People will usually describe elderly, childlike, rigid, and bad-tempered. They consider all the changes are normal and no attempt is made to intervene. But the truth is, cognitive function in later life is individualized. They are based on their personal resources, health status, and experiences in their own life. In fact, the incidence of mental illness among elderly is higher than young. Because elderly, they have to encounter with multiple loss, altered sensory functions, discomfort, and chronic illness at the same time. Research shows that elderly who are staying in nursing home are 2 to 3-fold likely to have depressions. To prevent mental health disorder, health promotion is very important. What we can do is to promote good mental health practice throughout the lifespan. Second, to maintain a sense of value as a member of society and self-worth. For example, we can encourage elderly to join activity in social welfare or anything they can find satisfying. Next, eliminate or minimize the limitation imposed by the conditions. We should introduce the reality orientations, make some correction of physical problem, and modifying the environment to compensate for deficit, so that the elderly can feel much comfortable with their conditions and their environment. The last one is strengthen capacity to manage the condition. We encourage people to find meaningful activity that they find satisfying, and provision of adequate income, safe housing, basic human needs, support through stressful situations are very important for elderly, especially the support. Elderly, they can receive the support from society, but the most important one is from the family. And the last one is physical health and good nutrients, because these can indirectly increase their capacity and their strength to overcome their stress and cope the negative feelings. Next, let's proceed to depressions. I'm going to give some introductions about depressions and explain about the precipitating factors, type of depressive disorder in later life, nursing consideration, and suicide risk. Everyone should know that depression is not a part of aging and is the 4th leading cause of disability in the United States, because depressions can affect their level of functioning, quality of life, cost of care, and mortality. Compared to young people, elderly who have depressions, they tend to have more somatic complaints, primary gastrointestinal, hypochondriasis, and agitations. But they also tend to have less problem about low self-esteem and guilt. To assess depressions among the elderly, we should notice about anhedonia and corroborating history with their family. For precipitating factor, I've divided into 2, which are biological factor and risk factor. Medication such as hormone, corticosteroid, corticotropin, estrogen, analgesic, as well as antihypertensive and cardiac drugs. These medications have side effects that tends to make the elderly to develop depression. Besides that, aging also compromises in brain neurocircuitries. For example, stroke, Parkinson's disease, and Alzheimer's disease that affect the frontal limbic pathway. Other risk factors are chronic medical illness, loss of a loved one, past history or family history, relocations, disability, and alcohol. The type of depressive disorder in later life can be divided into two, which are major depression disorder, MDD, minor depression disorder. According to DSM-5, people who are diagnosed with MDD, they must meet some criteria. For example, depressed mood, markedly diminished interest or pressure, significant weight loss or decrease in appetite, insomnia or hypersomnia, psychomotor agitations or retardation, fatigue, feeling of worthlessness or excessive or inappropriate guilt, diminished ability to think or concentrate, or indecisiveness. And the last one is the recurrent thought of death, suicidal ideations, or attempt to suicide. There are also some specific conditions stated in DSM-5. For example, people who are diagnosed with MDD, they must meet more than 5 of the following symptoms present during the same 2-week period. Do not include symptoms that are clearly attributable to another medical condition. Significant distress or impairment in social, occupational, or other important area of functioning. Whereas minor depression disorder, in DSM-5, it stated that minor depression disorder, they have episode of at least 2 weeks of depression disorder, but with less than 5 criteria required for MDD. We have to be aware that elderly that tends to have minor depression disorder, which are 2 to 3 times higher prevalence than MDD. Next, nursing consideration. As a nurse, we should know how to take care of patients with depressions. First thing we should do is to help them develop a positive self-concept by setting a new goal and assist them to find the opportunity to success it. We also should encourage them to express their feelings. Therefore, we should be their active listener and guide them through their feelings. Avoid minimizing feelings by telling them, "Don't worry, things will get better." Besides that, we should ensure that their physical needs are met, because patients should have good nutrition, activity, sleep, and regular bowel movement. Lastly, we should always offer hope to our patient. The last part about depression is suicide risk. We all should be noted that elderly that actually have higher risk for suicide compared to young, because the suicide rate usually will increases with age. Signs of having suicide ideations among elderly are medication misuse. It can be overdose or omission of dosage. Second, self-starvation by reject having their meals. And the last one is purposely engaging in activity that will threaten their medical problems. For example, patients who have CCS that usually have restrict of fluids, for example 1 liter per day, and they will try to drink a lot of water because they just want to threaten themselves. An assessment for checking whether they have the suicide risk. We should notice about their recent loss, new or worsening health problem, new symptoms of depression, changes or limited support system, or about their family history of suicide. In conclusion, nursing consideration regarding mental health disorder are monitoring the medications, promoting positive self-concept, and managing their behavioral problem. Medication can treat their problem very well and bring significant improvement. However, each medication has its adverse effects, such as anorexia, constipation, incontinence, anemia, lethargy, sleep disturbance, and confusion. Therefore, physicians should always prescribe the lowest possible dosage, and nurses should observe for any reactions. To promote positive self-concept, we should minimize the feeling of meaninglessness and hopelessness. The life review discussion is good for elderly because they can flashback what they have done when they are young, and they can feel the sense of history and satisfying. Besides that, we encourage them to engage in social interactions between people surrounding them, especially their family members. Next, to maintain the religious and cultural practices. Lastly, all the people, especially nurses, should respect them as individuals. Managing behavioral problems such as physically or verbally abusive, undressing inappropriately, repetitive actions, wandering, restlessness, and suspiciousness. Therefore, nurses should closely observe and document about the time, place, environment conditions, person presence, activity, pattern of behavior, signs and symptoms, outcome, as well as the measures that help or worsen conditions. So I finished to explain my mind map. Thanks for watching this video.